Let me start with addressing some of the concerns and frustrations with regard to the home recovery program. It is a very important program to help us live with COVID-19 and a very good example of how we are making a transition to a COVID-resilient nation. Because it's just like when we come down with other endemic diseases, we recover mostly at home when our symptoms are mild. And this is the case for the large majority of patients with COVID-19 infection, especially if they are young, if they are healthy, and they are fully vaccinated. So home recovery, the other important aspect is that it ensures that hospital beds are reserved for people who truly need them, where the symptoms are not mild, when they are severely ill. I want to emphasize that persons on the HRP, the Home Recovery Program, you are not left on your own to recover. We have introduced measures such as telemedicine to support you and care for you. The high number of cases in the past couple of weeks struck us before we can fully put them in place. And so I fully acknowledge that the past few days have been frustrating for you if you are undergoing home recovery. So we are taking immediate actions, and we have taken immediate action to address these concerns. Number one, we are receiving support from the SAF, which has augmented our resources and capability significantly. Second, this allows us to progressively clear the backlog that has accumulated over the past few days. And so we are actively, proactively reaching out to affected individuals, delivering the care packs on request. Third, we have joined their Telegram chat groups. It's very good that they started this to provide support to each other. And we have joined it so that we are able to answer your queries and also at the same time put out many of these common queries and confusion and clearing them through the mass media. So you have noticed full-page advertisements today, starting today. Fourth, we are expanding our hotline operators to assist those who want to have a call and talk to somebody with a query. I must acknowledge that there's even a private sector company that reached out to us and pledged their core operating resources to help us out during this period. Fifth, we are beefing up the telemedicine resources, including roping in private sector primary care providers to provide the telemedicine services. Sixth, we are also getting support from the People's Association so that volunteers can also provide community support to the affected families. And bearing in mind, whatever they do, it has to be contactless. So I'm confident that with all this hard work and all the help and support that we are getting, especially the SAF, the teething issues will be resolved as we speak.